Well, away from the revolt on Friday, as COVID cases begin to rise again in many European countries, governments have taken decisions to lock down hard-hit cities either partially or totally. In England, for example, residents are being asked to work from home if possible. Customers and workers must wear masks in shops. Also, any gathering of more than 6 people is illegal unless it meets one of the exemptions stated by authorities. This situation may appear remote to us here in Ghana, but don't forget that at some point, many of these countries were comfortable enough to lift lockdown restrictions based on science-based data. But as the scientists have always cautioned, the virus is dynamic and not so predictable. With concerns about non-compliance to wearing of nose masks, could Ghana be toying with a possible second wave despite current drop in our figures? Dr. Boajit Acosta is with Ghana's COVID-19 task force and he joins the show. Hello, Doc. Thank you so much for joining us. Now, there appears to be a correlation between the publication of a current case count and the attitude of citizens when it comes to wearing of masks, right?
Thank you so much. Let me greet your viewers and all those listening to you on JoyNews. Yes, obviously, as our figures keeps going down, it's not matched by our attitude in terms of the compliance. But what I'll say is that there are various factors that may be accounting for the reduction in cases in Ghana, which we continue to investigate. But the joy is that we did a little bit of research, and we saw that the workplace compliance actually is very high. Shop compliance seems also to be very high. So we certainly have to continue to advise that people adhere to the safety protocols. Now, from the Ghana Health Service and the Ministry of Information perspective, we have started a program where we are engaging the various regional House of Chiefs so that they are able to educate their subjects on the safety protocols. So what we aim to achieve is for the communities to own the preventive or safety protocols. And bear in mind, in Europe and other places where the pandemic started, to be honest with you, it keeps going up. So we are also putting in place measures to make sure that we prepare for any eventualities, or maybe if there is a second wave or anything. By that time, communities must be informed well, and the chiefs will be able to be in a position to actually take charge of that. So that is exactly what we are doing.
Dr. Boajit, there appears to be one aspect of this whole COVID-19 fight that we don't seem to hear much about, and that's enforcement. What's happening to that? We have a whole executive instrument laying out sanctions where people fail to wear their nose masks. And we know that it's been a major issue in cities like Kumasi. Health authorities are concerned that non-compliance is on a different scale, according to them. In Accra, we are beginning to see a decline as well. What's happening to enforcement?
Thank you very much. Let's put it this way. Knowledge and information alone will never change behavior unless it is done with things like enforcement and other interventions. And it is the reason why we advocated for the EI64. Now, we should also say that in our settings, for example, with the social distancing and the other things seems to be very difficult, but the wearing of the mask should be mandatory for everyone. Call on the security agencies to it's
Hello, Doc.
But it's organizations. Please, it is time for you to call to play your part to make sure that people are actually adhering to the safety protocols, especially the wearing of the mask, because it is the way out, and we cannot compromise on this. So we are pleading. I'm using your medium to plead to all organizational heads to make sure that they enforce especially the wearing of the mask, so that we continue to enjoy the reduction to a zero COVID-19 case in Ghana.
Doc, I can understand that you are appealing to the security agencies. Help me understand also if I'm wrong. You are with the COVID-19 task force, and I want to believe that there's a representative from the security agency there. So this mustn't be really an appeal that you're putting out on television, but do we know why from your task force why enforcement seems to be a struggle or a problem?
Obviously, yes. You see, the thing is, if you look at the safety protocols too, it is not part of our culture. We are now trying to accept it as Kenyans. So, for example, people will tell you that, oh, when I wear the face mask, I'm not able to breathe and other things. So I think that the end product that we want to achieve is behavior change. And doing this, we have to get the balance right. This is why it is prudent for me to appeal to all state actors helping in this COVID-19 fight to play their part, because it is not also only enforcement. It has to do with others. You can encourage people to actually wear it, but it needs to be repetitive. So this is the reason why we are using your medium.
Great.
So that continuous education becomes part and parcel of this.
I understand that, Doc, but I want to get to the bottom of the matter, and that's why I'm asking if there are any challenges that the security agencies are facing with regards to enforcement. And that's why I brought that preamble that you belong to a task force and there is a rep from the security agencies there, and you're all working together. So I just want to know, are there challenges? Are you having challenges? I'm sure if there are 1, 2, 3, 4, 10 examples, people will pick a cue.
I think it has to do with the perception that the disease has gone or is going. And that's what I'm saying. You see, in a pandemic like this, and for example, I use health promotion. What you have to do is to deploy all your arsenal so that if this one fails, this one is there. So, for example, if enforcement is not being done right, then we are also engaging the chiefs. We are engaging community actors to play their part, so that it comes together to help. So there is no one reason why you say that. It is multiple. And in this, we are trying to use all measures in our disposal to make sure that people comply with the safety protocols. Because people will tell you that they do not have any case in, let's say, the north. Why should they be wearing the face mask? So education. And education is the key to this. And this is why now we want the communities to own the education or the safety protocols so that they will they will actually comply.
All right.
So we will continue to engage the security agencies. We continue to engage the various actors to make sure that they actually comply with the safety protocols. But education is actually key. Not only education, capacity building. This is why we are building the capacity of institutions for people to understand what is actually happening. It is not always that you have to use force. You have to have a leverage and also know how to manage it. So that's exactly what we are doing.
Doc, before I let you go, there's something interesting about plans by government to absorb the cost for testing of players in our Premier League. There was an announcement that it could resume. Can you tell us more about that?
Okay, thank you. Yes, let me start by saying that COVID-19 test and its treatment in Ghana, everything is free. It is only the private facilities that we've accredited, those that we've accredited, that people are paying for. But in the government settings, everything has been free since day one. Now, the president actually eased for our under 20 and under 17 players to start training to engage in international assignments. We have done the test for them for free. Pursuant to the proposal that was submitted by the Ghana Football Association and the Ministry of Sports, Youth and Sports, and also the Sports Authority, we reviewed the proposals, we submitted our reports, and as part of that, the agreement was that the Premiership and the Division 1 should be allowed to start, but players and officials will be tested at no cost to them, but government will take charge of the cost.
Okay, Doc, quickly.
We continue to work with them.
Quickly, just help us.
We continue to work with them. So, yeah, please go ahead.
Just help us understand how this, when is this a one-off thing government is absorbing? Because we know the players don't live in a camp. They move in and out. So, I said, when someone shows symptoms, you test them, government takes the cost. Is that how it's going to work?
Okay, so we have two systems that we're going to operate now. Before they start training, we will test them. Then when the Premiership starts, we will test as well. Now, this is the scenario. Health workers, some were tested, and we keep going to work. The infection is in the country. So it's the same scenario that you have to apply. So, for example, if the players are going for training, government will do a one-off testing for all the players, the Premiership and the Premiership and Division 1 before they start the training. Then we treat those with positives and we allow them to join later. But during the when the season is about to start, we will also make sure that they are all tested. So we've agreed on that. Those are the systems that we're going to use.
I really appreciate your time here this morning. Dr. Da Costa Boaje is Director of Health Promotion at the Ghana Health Service. And we've been talking about a lot of things, non-compliance to the wearing of masks. And we just ended with that conversation on government's plan to absorb the cost of testing and treatment for players, even as they prepare to resume the league. And he was just sharing with us how it will work when people have symptoms or when people show signs. So there you have